Happy New Year for the people of Wales if they support Plaid Cymru in the elections. But my question is, how is the Welsh Government ensuring that adults with learning disabilities and autistic people are supported?
Well, I wish to wish everybody a Happy New Year, and I know that we're all ready and willing to do everything that we can for the people of Wales over the coming weeks and the coming months. And I'm sure that there will be a lot of energy and fun will be had in this chamber. The Welsh Labour Government knows that life is very difficult for people with learning disabilities and autistic people and their families. And that's why we as a government have ensured that we're continuing to provide support to push things forward and improve people's lives through having an action plan for learning disability strategic action plan and a neurodivergence improvement programme. And through that, we are helping people to feel confident and having a chance to succeed in every part of their lives.
Diolch. I've raised with the government on more than one occasion the impact funding decisions have on the delivery of safe, lawful and sustainable commissioned social care services for people with learning disabilities and autistic people. Your response has been that the Welsh Government has committed to the social care real living wage, ignoring the fact that funding granted to local authorities has consistently not covered the full cost of delivering that commitment. Dimensions Cymru is a not-for-profit provider supporting 112 adults with learning disabilities and autistic people in supported living homes across Wales, including in my region. And they've told me that funding shortfalls translate into increasing difficulty maintaining staffing levels, growing rota pressure, reduced service resilience and uncertainty for skilled frontline colleagues. Your Finance Minister has said that this is a very serious matter in response to a question from me. So will you therefore ensure sufficient ring-fenced funding in the final Welsh Government budget so that social care real living wage funding reaches frontline roles as intended and providers can meet their statutory responsibilities without compromising safety?
Well, we are one of the only parts of the United Kingdom to promise to deliver the real living wage for care workers, and that's precisely what we've done. We did it far earlier than people expected us to, because when Welsh Labour says they're going to deliver, we deliver. That is what we've done. What is important now is to recognise that that additional funding has gone to local authorities. There's an additional amount of money which I hope will be agreed next week. And we know that the way that we allocate funding in Wales is that we give that allocation to local authorities and it is up to them to work it. We are very clear. We believe in subsidiarity in Wales. We believe in empowering local authorities to make those decisions on behalf of the communities that they serve. So I'm not going to apologise for that. We give them the money. It is important now that we make sure that that people get the money that is allocated to them, and it is important to recognise also that the minister responsible for mental health and well-being will be making an announcement next week. It'll be a written statement on the 20th of January, and that will look at how we make sure that people with learning disabilities in particular don't have a situation where they have to live in hospitals. We need to move them into their homes and give them the support that they deserve and need.
Mark Isherwood.
Only yesterday I attended the care and support plan of yet another autistic Flintshire constituent at their request. The Social Services and Wellbeing Wales Act and its codes of conduct states an individual must feel they're an equal partner in their relationship with professionals. The care and support plans must contain a clear date agreed with the individual by which the plan will be reviewed. In the case of an adult, the date of review must not exceed 12 months. This was 2 years. In all cases where appropriate, with agreement of the person concerned, the local authority should also involve specified others, including other practitioners, professionals with expertise in the circumstances or needs of the person concerned. And that where eligible, care and support needs have been identified and the individual expresses a wish to receive one, direct payments must be available in all cases where they enable personal outcomes to be achieved. But these requirements are routinely ignored? What is the purpose of Welsh Government legislation if it is not monitored and, when necessary, enforced, or at least support put in place to ensure that the practitioners are doing it right?
It is important to recognise the difficulties that many people living with autism and neurodivergence conditions suffer, and it is important to recognise the support that is needed for them and also their families. And that's why we do have statutory duties set out in the Autism Code of Practice. We have pilots and new ways of working to develop needs-led early help models, and we recognise that more needs to be done in relation to waiting times and to deliver that post-diagnostic support. You are quite right. We need to make sure that that the statutory duties that we set out in law are actually enacted, and we do have organisations to make sure that that happens.
Jane Dodds.
Madam Llywydd, and good afternoon, First Minister. I'd like to thank Sioned for raising this issue. There's a really even more shocking statistic, which is that people with learning disabilities in Wales die on average 20 years younger than the general population, with the most common age of death being just 67. Nearly 4 in 10 of these deaths are considered avoidable, meaning people could still be alive today if they had received the right care at the right time. This is nothing short of an outrage and discriminatory. Despite annual health checks being added to the GP contract last April, a report from MENCAP last week shows that over a quarter of people with learning disabilities were not offered a health check in the past year. Going back to Sioned's point, which is about enabling our third sector organisations, I'd like to talk about the closure of Powys People First, which was last year, an organisation that advocated on behalf of people with learning disabilities. Without this vital community effort, health checks risk becoming little more than a tick box. So what will you do, please, First Minister, to ensure that people across Wales who have learning disabilities receive the annual health checks, but also have the access to advocacy and community support through third sector organisations, and ensure that adults with learning disabilities do not die so young? Diolch yn fawr iawn.
Well, we have a very clear plan, the Learning Disability Strategic Action Plan. This was published in 2022, and I'm very pleased to say that 33 out of the 35 actions have already been completed. The other 2 have been adapted or amended as a result of changing priorities as a result of COVID. And we all read that report of how people with learning disabilities in particular suffered more than others during COVID, and it's important that we respond to that. What we'll be doing next is to set out what we're planning to do to respond to that Stolen Lives Wales from Hospitals to Homes report that has been written by the Learning Disability Ministerial Advisory Group. They, I'm sure, will have a lot to say about the annual health checks, and I will make sure that the written statement refers that is going to be published next week refers to the annual health checks.
Cwestiwn 2, Carolyn Thomas.
Will the First Minister make a statement on the Royal Alexandra Hospital development following the granting of planning permission?
Local people have waited